move, Phil, and can I move this
so
that I can have it,
no problem.
my paper here?
And I think we're all set to go whenever you folks are ready.
All right. Good morning, community of Santa Cruz County. Thank you for joining us today. It's been a while since we've had a formal press conference, and we have a lot of information to share with you this morning. I hope that you're all aware that we've had dramatically increasing numbers of cases and that our case rate has increased to the point where we are now formally flagged on the state's county monitoring list. The numbers that we have today have not yet been updated from yesterday. We have a total known reported cases of 848. There are many additional cases that have yet to be reported onto the data dashboard. This takes some time, and our staff is overwhelmed by the sheer number of cases that are increasing every single day. Doing some town halls this past week, I learned that some of our community doesn't understand what we mean when we say the word case. So when we use the term case, that means a single person who has been diagnosed with COVID, either through testing, which is the case the vast majority of people who have been diagnosed with COVID-19, or because of clinical symptoms that lead an experienced clinician to diagnose COVID without a test. This is a very small fraction of the total number of cases, but that's what we mean by the word case, is a person diagnosed with COVID-19 in this context. So of our 848 reported cases as of the end of the day yesterday, 511 of those are active known cases. That means that over 2/3 of our cases have been in the last 2 weeks. This is a dramatic change for the County of Santa Cruz. So far, we have not seen a huge increase in hospitalizations or deaths, although we are beginning to see the impact on our hospitals. And in fact, yesterday we hit our trigger of 20 hospitalizations in the county at one time, 20 people hospitalized with COVID. And that did not count many more admitted who were waiting for test results. The dashboard still reports 3 deaths, but I am also announcing today the death of a 4th person with COVID as a contributing factor to the death. This person was a male in their 70s and was hospitalized with cardiac issues, but during the hospitalization, it was discovered that he was COVID positive, and so COVID was listed as a contributing factor on his death certificate, and we will be counting him as one of our deaths. So we are up to 63 reported hospitalizations to date of our COVID patients. And as expected, and as has been the trend, most of our new cases have been through person-to-person spread, through close contact, usually with people that are together closer than 6 feet for over 15 minutes, often without face coverings. So again, it's those multi-household unit gatherings of friends and families. And I remind you all to look at our santacruzhealth.org website, and you can follow all of the current data. One of the things that you'll see is a continued trend toward new cases in South County. So most of our new cases still are in Watsonville or the surrounding unincorporated areas. Many in the Latinx community, although we're seeing more in the Caucasian population now. And many in the 18 to 34 year age group. So here in Santa Cruz County, as well as throughout the state of California and nationally, we're seeing growing numbers of cases in the young adult sector. This is understandable because this sector, this age group works often at the front lines as essential workers, requiring contact with the public, less likely to be virtual workers. It's also an age group that has grown fatigued of being sheltered in place and living with parents in many cases, and are just tired of that and want to get out and have some fun. So a reminder that we want to minimize mixing. If you are with people outside of your household unit, it's important to keep the 6-foot physical distance, to be wearing your face covering at all times, and to follow all social distancing requirements, including staying home when you feel sick, covering your coughs and sneezes, frequent hand washing, cleaning surfaces regularly. All the things we've been telling you since January. So let's talk a little bit about the flagging and what that means. So the state has a database that has a built-in 7-day lag. So although our own data here generated in the county showed that we had crossed the case rate line of 100 cases per 100,000 in the past 14 days, more than a week ago, the state has just flagged us as of yesterday, so day 1 was yesterday, flagging by the state. Assuming we continue on trend, which I don't see any way to reverse that at this point, we will be flagged for 3 days, then officially placed on the monitoring list. After 3 days on the monitoring list, we will be asked to put further economic restrictions in place. We will be joining 90% of California's population that's already under these restrictions, and it will close indoor operations of fitness centers and gyms, religious and cultural ceremonies, including wedding and funeral services, offices for non-essential sectors, personal care services like nail salons, body waxing, facials, and tattoo parlors, hair salons and barber shops, and malls. Any of these services that can be transitioned to an outdoor setting may continue to function, similar to restaurants, food service in our area. And so this should be in effect in approximately a week from now. And then we'll be working closely with the state to develop the next set of orders. In fact, I will be asking the state health officers to write those orders for us. And we'll be working with them to closely monitor and continue to watch our triggers. I think I'll leave it at that for now and let Mimi take over. Thank you.
Thank you, Dr. Newel. As Dr. Newel had pointed out, we have this exponential growth in our case rate, and many of you have heard us talking for weeks about the preparation we're doing for testing and contact tracing. So as you may know, the testing scenario across the nation is not where we expected it to be today. Our private labs have sometimes a 7 or 10-day turnaround time for tests, which makes it very, very difficult to contact cases right away. And from a contact tracing standpoint, when you have a volume of cases coming in every day that is somewhere in the range of 50 to 100 to maybe even 200 that you don't know are cases yet, but you've got to go through, the most efficient way and effective way to control and contain the spread of the disease and save lives is no longer relying on contact tracing alone. So I wanted to let the public know that we're shifting our efforts to a population-wide effort, and that's why we're asking for everybody's assistance to stay at home, be mindful of symptoms, follow all of the instructions that we have provided all along since January and February, but now it's even more important. So in addition to asking for the public's help, we're also asking for help from employers and providers as well. So if you go onto our Save Lives website, you will see that there is a whole, I guess you call it a button for employers. And the reason for this is that when someone's positive, they're going to know before we do. Usually they get their test result, their provider gets their test result. It may be a number of days before the public health department gets alerted of that. Those are days wasted. So the first thing most people do is alert their employer. So this is our way to engage employers to begin acting quickly and start beginning the process of contacting traces and helping people isolate. And there's actually a workflow for them to provide that information to us and a trigger of when they should contact us immediately. Likewise, we'll be asking providers to help us to do the same thing. They're already doing this and instructing their patients on what to do to stay safe should they test positive or what their household members can. But we'll be working on ways where they can provide us with that early information, which is actually beginning the process of contact tracing, because this is a population health problem. This is a huge problem. And in public health, we do population health. We don't treat one person at a time. So a population health problem takes a public health approach, and part of that approach is getting everybody's help to do this. I also wanted to talk about specifically what we're seeing in cases and clusters, because when the public sees that we have 850 cases, and I'm pretty sure that by the time Monday arrives, we'll have a dashboard that has well over 1,000 cases, I don't know if that means something to people. So we have a number of clusters and outbreaks across our community. We now have had cases in residents or staff at 5 of our 7 skilled nursing facilities, and we have been working to protect the residents of those facilities and minimize the impacts on those populations. Fortunately, we have been able to avoid any deaths amongst any of our skilled nursing residents in Santa Cruz County. We did have a jail inmate test positive for COVID-19. However, the really, really good work of the sheriff's office in putting policies and measures in place have helped to contain that case. In addition, we have had an outbreak amongst a shelter in South County and worked very, very quickly to place everyone in that shelter in isolation and quarantine. And we've had cases at several of our long-term care facilities. In addition, clusters have been identified in several workplaces, which prompted our early action to engage employers in taking action before the public health department receives notice. And these cases have primarily been passed between staff members. And luckily, we haven't seen transmission between staff and the general public or folks who are visiting these businesses, but it makes sense that people who work together, are taking breaks together, eating together, removing their masks to do that, and it's really of a concern. So what can the community do, and what are we doing going forward? Again, we know everybody is tired of shelter in place, and although the orders have been lifted, we really need everybody's cooperation to be diligent, to think about those around you and think about your family members and your more vulnerable community members. So going ahead, there are 3 main things that we're doing. Our board, with great concern at the current situation in Santa Cruz County, has instructed staff to come to them with recommendations on what measures that they may be able to take as a governing entity to help control the spread and assist containment and reduce the amount of transmission that's happening because of people's behaviors. Secondly, what we're doing is we have underwritten additional equipment purchase at UC Santa Cruz. We are going to be able to triple, perhaps quadruple their current testing capacity by an infusion of almost $1 million for them using our CARES Act funding for public health. And that is part of a testing plan that we have countywide so that we don't rely on private labs, we don't rely on the state or the federal government supplies. And in addition to that, we'll also be purchasing additional equipment for our own county clinics as well as a couple of health system partners. So there are multiple redundant forms of laboratory testing available locally. And then finally, Dr. Newell may want to chime in on this. The governor removed local health officers from having to decide whether or not schools may adopt a distance learning model. This has always been the case, but local health officers can still play a role. But we wanted to make clear that it's not Dr. Newell's call, nor is it her area of authority in terms of the decision making at the schools, but she's had a really, really great relationship with our local county office of education and has been meeting regularly with the COE and all of the superintendents. I know that it's Dr. Newell's goal to allow any school that decides that they want to go to a distance learning only model, if they have the support of their board, all of the parents, as well as the COE. Dr. Newell's happy to support their choices. And I should actually leave all those points up to you. But that's all I have in terms of what's next for us. I don't know, Dr. Ghilarducci, if you want to say anything about the state of the hospitals or our surge plans.
Sure. Good morning. Just a few words about the state of our hospitals. They continue to do very well. The hospitalization rate is going up, but so far is manageable. As we've said before, our main concern is ICU capacity. So far, that still continues to look good. We are looking at reactivating our surge or alternate care site kind of model with some variation. And our goals at this point are to maximize any hardscape that currently exists within hospitals. So if there's some unused space within hospitals, we want to try to maximize that rather than try to set up something like multiversity, which we had done before. We think that's a far more efficient model. So we're in talks on doing that. Our PPE supplies are slightly stressed at this point, but I think we're in a different situation than we were in April and in May, and that the supply chain seems to be a little bit better, although we expect pressure to continue there. And then finally, I think probably the scarcest resource right now is remdesivir, which is one of the few drugs that's been shown to be effective, that and dexamethasone. But remdesivir is the short supply. It's limited amounts are allocated to Santa Cruz County, and we've been distributing that between our two hospitals, certainly purchasing the maximum amount that we're allowed to purchase. So we're hoping that that supply will continue, but it's not limitless. Thank you.
Thank you, Mr. King. I think we're going to go to questions now. Do you guys have any questions?
Why don't you take the phone first?
Okay. Well, first up, we're going to go to the phone. Jake Pierce from the Good Times. Hit star 61 to unmute your phone and go ahead and ask your question.
Yes, hi everyone. Dr. Newel, you mentioned last week that there was, you indicated there was reason to believe that the recent protests and the memorial for the sheriff sergeant had contributed to some extent to the rise in cases. Now that we've had a week more of contact tracing, what more can you tell us about that possibility? What do we know about that?
Thank you, Jake. Good questions. Last week, I was thinking that perhaps with the rise in the 18 to 34-year-old age group and the shift to additional or more cases in the Caucasian population, I thought that perhaps this was reflective of the protest activity, but that seems to not be playing out in our case investigations. It continues to seem to be gatherings over a long period of time with close contact. So family celebrations, gatherings with friends in backyards. So not so much the outdoor marching movement activities. So,
and so also not the memorial. Then there were a lot of people gathering without masks, from what I saw.
yes, and that was a big concern of ours. We have not identified a single case at this point related to the memorial.
Thank you.
Outdoors matters. Next, we're gonna go to Nick Ibarra from the Santa Cruz Sentinel. Nick, hit star 61 to unmute your phone.
Thanks, Jason. Hi, Dr. Newell. Thanks for doing this again, and Dr. Ghilarducci, Health Director Hall. I'm wondering if you could clarify a little bit about this state watch list. You mentioned that we're officially flagged on the list, but it sounds like that's not the same thing as being on the list. And it sounded like you were laying out 2 3-day periods, the initial 3 days for being flagged on the list, and then 3 days that we would have to remain on the list before additional restrictions would take effect. Can you clarify that? And is there a date that you would expect those additional restrictions to take effect at this point?
Thanks, Nick, and you've got that exactly correct. Number one, it is confusing, and it's taken clarification for me with the state to understand the process. And number two, you're correct that there are 2 3-day periods. So initially, we're flagged. So all 58 counties are currently listed on the county monitoring list that you can find on the governor's website. And on that list, there's a series of metrics, and if you are good with the metric, you get a black check mark in that box. When that check mark changes to a blue number, that's an indication that we're flagged. So that happened to us yesterday. So it's kind of a warning to the county and to the public that they're watching us. And if we continue to have 1 or more blue numbers for 3 days, so that's 3 days of flagging, then we officially join the monitoring list. So then you will see on the state map, you'll see our county turn from blue to yellow. And then after 3 days at yellow, then we become orange. And that puts us solidly in the county monitoring list. We are then a restricted county. And then we will work with the state health officer to put orders in place. And that takes a few days. So there's not a specific date because depending on where the weekend falls, how busy the state health officer is, it's a few days after 3 days on the monitoring list. So we're day 2 of 6 days before we start working on health officer orders.
Does that include weekends, business days?
Does it include weekends every day?
Those 6 days does include weekends, yes, every day. And I'm looking to Dr. Ghilarducci because he's the interim health officer for San Benito County, so he has personally been through this with the state. And you wrote your own health officer orders, correct?
I did.
Yes.
Right, yeah, and I would just clarify one thing. The check boxes that you'll find on the county monitoring list, my experience in San Benito was those actually didn't turn blue until after the 3 days.
Oh, we got a blue one yesterday.
Oh, we did? Okay.
We did, yeah.
All right, so maybe the process changed a little bit. Thank you. Okay.
Is somebody in the room?
Drew, you got anything?
Yeah, I do. I guess I can kind of follow up this. Dr. Newell, you mentioned that it's almost too late to not go onto that list. Can you kind of just explain why that is, and then what is the only thing that can put us more on the right track?
I definitely don't want to message to the community that it's too late to do anything. But if you'll remember, I talked about that 7-day lag. So we know in the past 7 days that we've continued to increasingly go upward on our curve. So we have a steeper upward curve than ever. But at any point, we could again flatten the curve. And all it would take would be for every member of the community to follow the simple social distancing requirements. I heard from the CDC this week that if every person in this country would just follow those simple social distancing requirements, the pandemic would be over in 4 to 6 weeks. We'd be done. The economy could fully open again. So if we could just do those 5 things that I keep talking about. I'm going to say them again. I know it's boring, but wear your face covering whenever you're within 6 feet of anyone outside of your household, and in any indoor spaces where you're sharing a space with others. Wash your hands frequently. Stay home if you're ill. Maintain that 6 feet of distance between yourself and others, and cover your coughs and sneezes. If we could do that and not gather, we need to minimize mixing, no gathering outside of your own household, we'd be done. It's that simple. So it's our individual behaviors that determine our community outcome with this disease, and ultimately the economic recovery.
Gail, will you mention how long we'll stay on the watch list?
The watch list, we are on that as long as we will have economic restrictions until we drop below those measures for 2 full weeks.
Hey, Dr. Newell, you mentioned that, or maybe actually did, I believe, about UCSC receiving $1 million for testing. Is the federal and state failing us? I mean, because we're getting 7 to 10 days when the results come back. I've also heard that they're losing our tests. At least once, twice on the same individual. So do you feel you've lost confidence in the state and federal testing that's going on here, and that's why you're opening up UCSC, and hopefully depending on them to get the results back quicker and accurately? That's one of the questions.
My understanding about testing scarcity at this point, and then this has changed throughout the past 6 months as we've worked with this, but right now there's a global shortage of testing reagents, so the actual chemicals you need to run the tests. And so that's all over the world. With increasing cases, especially in our country, there's increasing demand, and the laboratories just can't get the test reagents quickly enough to run the tests. So it's not a matter that it's a state system or a federal system. But we are so fortunate in Santa Cruz to have this partner at UC Santa Cruz who have developed their own lab testing system that will allow us to perform labs here with Santa Cruz County residents as a priority. And so that's part of this partnership, is we help them get the equipment they need. They have an ample supply of the reagents they need. They're not reliant on a commercial entity to produce those. And so we're very hopeful that we'll have a solution in the short term.
Now, currently, they're not taking on the numbers, obviously, like they're taking over Ramsey Park and the like. By opening this up, are you going to have to limit the number of people who would be allowed to use the facilities at UCSC? In other words, first responders would be the first people to receive these tests? Is that the way it will work for now?
We have developed a local testing priority structure, and it starts with hospitalized patients, of course, the sickest patients. And so it very much mirrors the California Department of Public Health testing strategy. They released theirs about a week after ours, and we think they copied ours. But they came up with a very similar testing strategy as we have. Next in the list are exposed healthcare workers and first responders, and our contact tracing case investigation needs to control clusters and outbreaks.
Yeah. And Phil, I want to clarify that UCSC will not be collecting the specimens. They'll simply be the lab that we're using. So we're also working with the healthcare system and the safety net clinic system to be the collectors of those specimens for their own patients and others as well. So what's likely going to happen if the state doesn't come through with continuing the Ramsey Park site after August 31st, and by the way, I've been going on their website every day and you can't get an appointment, so we'll have to figure out what's going on with that. But the idea is that when that site goes away, we're going to create capacity across all of our communities where people would receive care normally, and where sites are already doing drive-through and drive-by testing. That way we don't rely on one site, and it's less a matter, this model is less a matter of confidence in the state and federal government, but knowing that if we're going to protect our community members, we're going to create our own local system of laboratory testing.
So do they need a doctor's, recommendation to go there, or when will this go into effect? I guess is with UCSC.
So first of all, they haven't even purchased the equipment yet. We gave them the go-ahead to order the equipment, and they were poised. They already kind of pre-alerted all of their vendors gave us an entire list of equipment that they needed. We gave them the approval to move ahead last week, and this is actually a pre-approval. I got emergency approval from the CAO's office to do this because it's very important not to wait a week or two until the board convenes. So that still has to be done, and then there are a number of other things, including getting electronic lab, many things, and we're working on all of those.
So let me get this right then. So I can't get an appointment for another week. It's going to take me 7 to 10 days before I know the result if they don't lose it. So it might be a month before I find out whether or not I've got this disease.
So it depends. So if you go to your own healthcare provider or you're in the hospital, we are expediting those tests in partnership with our own local lab in our clinics or with UCSC. So we're making sure that the people who need the testing the most are getting the results soonest. But if you go to a public testing site, the Ramsey Park site, you're asymptomatic, you're probably curious, or you think that you have been exposed. Those are the tests that are coming back. They're totally useless. A test that comes back 3 weeks after you've taken it, you've already passed the quarantine time. And so what we really want to do, and this is the reason that Dr. Newel is encouraging everybody, forget about waiting for a test to tell you whether or not you've been exposed. If you think you have, or if you're exhibiting symptoms, stay home, social distance, wear your mask, wash your hands.
And just the problems with the OptumServe delays have to do with the commercial systems. They're system-wide problems. They're not unique to that site.
Yeah, they use Quest Laboratories, and they actually have several sites across the nation. So every OptumServe site across the nation is experiencing that delay. A lot of it has to do with availability of supplies, reagents, and things like that.
If I could make an observation, I think to your earlier point is what we found, I think, throughout this pandemic, if it was PPE, if it's remdesivir, or if it's testing capacity, is that there's a limited supply nationwide, and the states are in a position of competing with each other for those limited resources. So to the extent that each state can solve its own problem, I think that is probably fallacious.
And also, I just want to point out that people will not be going to UCSC for a test. Please don't contact them. They're the backbone of a testing regime.
UCSC Student Health will be collecting samples on students, staff, and faculty, but that is it.
So they're just doing the testing per se from these other people that you mentioned, I guess, health workers and the like, hospitalizations and things like that.
We do have a question from John D. Gomes. Do we have signs of an outbreak in the mixed-tech community?
So far, the County of Santa Cruz has been relatively spared from outbreaks in the agriculture community. That doesn't necessarily correspond to Mixteco, but a lot of that community is our agricultural workers. And I know Monterey County's been very hard hit, but we've been largely spared. And I have not been alerted to outbreaks or clusters in the Mixtec community.
And we have a question from Kara Guzman from Santa Cruz Local. Kara, if you can hit star 61 to unmute your phone, and then go ahead and ask your question.
Hi, I had a question about the backlog of tests that have not been entered into the system yet. Can you give us a little bit more detail on why that is? And does that also mean that there's a delay in when you can start contact tracing investigations?
Yes and no to the delay in contact tracing. The delay, the data cannot be entered into the data dashboard until it's been entered into the state system called CalReady, which is the reporting system statewide. Many of our laboratories do not report through electronic lab reporting, which would automatically feed into that system. Instead, we receive faxes or emails with lab results, and those have to be manually entered into the CalReady system. The CalReady system was down most of yesterday, and we have had some staffing shortages, especially on weekends and holidays. And so there's been ups and downs in the reporting, but the overall trend is accurate.
Thank you. I want to remind everyone to please mute your phone. We're getting some feedback on the phone.
The second part of Kara's question was, does that cause a delay in contact tracing? And not necessarily. We're beginning some contact tracing before entry into CalReady system.
Thank you. Nick Ibarra from the Santa Cruz Sentinel, go ahead and ask your question.
Thanks. This question is for Director Hall. You talked about shifting from contact tracing to a population-wide effort, and I'm wondering if you could expand on what that means and whether shifting away from contact tracing primarily is a reflection of a lack of personnel and amid the growing number of cases, or what is driving that. Can you just expand a little bit more on what that means and maybe reflect on whether that's whether a similar change is happening in other towns in our region? Thanks.
Sure. I'll start with your last question first. So yes, absolutely. This is a shift that's happening in other areas that are experiencing the exponential growth that we are. If there were a pandemic playbook, and there is, we know that when we get to this point, when you're unable to contact each new case within 24 hours and begin the case investigation within 48 hours, that it means that you have to do something different. So I might have misspoke when I said we're shifting away from contact tracing. We're not shifting away from contact tracing, but with the volume of cases that we have to prioritize our contact tracing. So just like we've prioritized what populations get tested, we are prioritizing which populations are prioritized for quick contact tracing. So if you're in a vulnerable population, if you live in a congregate setting like a SNF, if you work in a concerning industry, so all of those things would flag a certain case for prioritization in having a team investigate immediately. If you go to our website for employers now, there's also a way for employers who may get information before we do to flag us so that we can intervene quickly. In terms of numbers of contact tracers, we have 69 contact tracers between permanent staff, volunteers, disaster service workers, although 23 of them are still in the onboarding process. The state estimated that we would need 41 for our size of county. So I'm going to emphasize that when you get to this stage of the pandemic, you cannot contact trace or test your way out of it. When it becomes a population-sized problem, you have to take a population approach, which is exactly what we're doing. It doesn't mean we're going to stop the testing and the tracing, but it's not small enough or containable enough that those two measures, let's just test everybody, and then let's just trace them immediately and tell them what to do. There are too many people who are being exposed now, so we have to rethink our strategies of how we use testing and tracing.
May I jump in?
Thank you.
I just have a quick question regarding the number of clusters. Can you put a number on the amount of clusters we're seeing in Santa Cruz County right now? Is it a dozen or more? Or? It's
under a dozen. I think at our last count it was 8. I didn't pay attention this morning.
And when you say a cluster, it's how many people minimum, I guess. What's considered a cluster?
When we have 3 or more cases connected with an index case. So you might recall we had we called them Mother's Day cases. We had 4 clusters as a result of a number of multifamily gatherings. And so one cluster can turn into multiple clusters. So depending on how the household setups are and their contacts and everything. So clusters are important because, so the Mother's Day cases, the Mother's Day clusters, those family gatherings resulted in more than 50 cases. So you can see how important it is to intervene quickly when you have a cluster or an eventual outbreak to try to mitigate that as soon as possible.
Thank you.
Thank you. Jake Pierce, do you have another question? Hit star 61 if you're not unmuted.
Yeah, can you hear me?
Yes, you're good.
Okay, great. So yeah, how is it that, it was a couple months ago, maybe now, that we heard about this kind of strategy for ramping up our contact tracing capacity. How is it that the contact tracers are still being onboarded? How is that process not finished yet?
Yeah, it's because it's a very long process. It's not like you get a job as an accountant, and if you're not really trained, you just have like a 1 or 2 day training. So there are a number of things. They have to go through background and security clearance. And then there's a required state training that's a 20-hour state training, and it takes most people a whole week to complete that 20-hour training. After they do that, the new platform that the state uses called CalConnect, that is it's kind of like the electronic platform system that they must use that connects into the CalReady, is an additional training. And so it's not like you hire them and they can start tomorrow. And then contact tracers don't work on their own. So, Gail talked a little bit about staffing shortages. I think many of you are aware that we're under mandatory furlough. So we're not exempt as public health workers. And so we have been trying to balance how do we do coverage and furloughs and work on skeleton crews. So there are a lot of pressures on the staffing complexities that impact us. But as far as the contact tracers go, I was starting to say they don't work on their own. They work within a team of a case investigator and a supervising nurse. And so we need all of those positions as well. So we have quickly hired a number of those positions recently. But I will tell you, although we have a quick infusion of funds from the federal government through CARES Act, it's not forever money. So I have a lot of worry, but we're working on planning how we're going to sustain this level of effort for the duration of the pandemic, and hope that additional funds and support come through from the federal government.
Thank you. We have a question from Erica Mahoney. Erica, if you can hit star 61 to unmute your phone and go ahead and ask your question.
Hi, good morning, everyone. So, my question for Dr. Newel, good morning. You've said in the past that there's people walking around in the community who don't know that they have the disease. And recently the CDC found that for San Francisco, we've had figures in late April that it's estimated to be like 9 times the amount of people who've been infected. And I was just wondering if you could comment on that. Because we have listeners who say, these are the confirmed cases, but what's the real picture?
Yeah, we wish we knew that. As we learn more about the virus, we get better numbers around that. But with testing scarcity, I would say that the number of asymptomatic people without any signs of illness who have no idea they're infected, is much greater than 9 times our number of cases. I would say it's closer to the 20 to 30 that has been quoted in earlier times during this pandemic. So instead of 1,000 people in our community who are currently infected, it may be 20,000 or 30,000. So that really stresses the importance of everyone keeping their face coverings on and keeping your physical distance.
Okay, wow. And then a second question, and it's about the schools reopening. So from what I can understand, under Governor Newsom's new regulations, if a county remains on the watch list, or they have to be off the watch list for 2 weeks before they could maybe transition away from distance learning. So with your message that it wasn't under your direction that the Santa Cruz County Office of Education made the call to do distance learning for all schools, how does that play out, let's say, if the county is off the monitoring list, or if it's still on the monitoring list, if a school wants to maybe not do distance learning?
Yeah, we've been going along with the governor and California Department of Public Health on a journey about how best to navigate this. And initially, it was thought that the health officer would need to approve distance learning only. And then the language was clarified through the legislature that the health officer would offer guidance, but would not have any authority in that decision. I did advise our County Office of Education that we were likely to be flagged for at least one of the 14 days before the expected day of opening. And in anticipation of parents needing to have some time to make arrangements for their children, the County Office of Education didn't want to make a last-minute decision about what they were planning to do. And so they decided to go ahead and do distance learning only. Now, a new development has arisen, and the exact mechanism has not yet been determined by the state, but there will be an opportunity for elementary schools only, so at least up through grade 5, to apply for a waiver with the state to open their schools for classroom learning. And it could be a hybrid model or a full-day classroom. And that can only be done with the support of the district superintendent, the teachers and staff, and the parents. And that needs to be demonstrated. And then the local health officer needs to authorize the waiver from a health point of view to say that we have adequate testing and contact tracing capacity for that to happen. And if that's the case, then we can forward that application to the state. The process is yet to be determined.
So even if you are on the monitoring list?
That's correct.
Okay. And I'm sorry, could you just clarify what your role would be in approving that, providing some sort of evidence?
Yes, I would need to authorize the application to move forward to the state.
Thank you.
Dr. Newell, on a somewhat similar topic, there have been some announcements this week about the delay in the return of high school sports. I'm curious your thoughts on when it could be safe for kids' sports basically to return.
We've been in conversation with the governor's office and state leadership as health officers all week this week, and we anticipate perhaps as early as today, maybe Monday, that there will be an announcement about the release of the governor's guidance on youth sports. So it would include school-related sports and non-school related sports. And there will also be additional information about adult sports as well with amateur leagues. The news, however, is not good. Okay. I can tell you that. Basically, it will focus around individual conditioning and distanced drills.
Thank you. Tony Nunez from the Register Pomeranian, you have a question? Hit star 61 to unmute your phone.
Yeah, this is a question for Dr. Newell, and this is a question pertaining to Watsonville. This is Tony Nunez with the Pomeranian newspaper down here in Watsonville. I'm wondering now with additional contact tracing and now a few weeks removed from the spike that moved Watsonville cases ahead of the rest of the county, do we have any other, is there any other indicators that can tell why Watsonville has been so hard hit, and is there any plans to focus in additional testing on the Watsonville community and the surrounding towns around it in the unincorporated areas of the county? Thank you.
Thank you. Very thoughtful question. We continue to work closely with our partners in South County, so the PVPSA and others. Salud para la Gente is a fantastic partner in the Watsonville area. We're working closely to improve our messaging and continue messaging around individual behaviors and the dangers of group gatherings. And in addition, we're working with Salud para la Gente to be partners with us in our contact tracing and case investigation work, and for outreach to not just their own panel of patients, but to the greater community. Did I hit everything in your question?
Yeah, is there any indicators as to why Watsonville has been the hardest hit community in the county?
Well, Watsonville isn't alone. This is happening in communities of color throughout the United States and in California, particularly the Latinx population. And it has to do with those social determinants of health that we keep talking about. The crowded housing, the poverty levels, lack of access to healthy foods, to safe living environments. So all of that plays a role. In addition, the Latinx population is more represented in the frontline workers, the people who are serving us every day, who need to be in contact with the public day after day.
And so to that point, Dr. Newell, have you seen any outbreaks in employers down here in Watsonville that have been slow to inform you guys of them? And for that reason, there's been outbreaks over here?
Initially, there were some employers who were not up to speed on the social distancing requirements and face covering requirements, but that has greatly improved. And we have found employers and businesses in Watsonville easy to work with.
Thank you. We have a question from Adriana Frederick. She is wondering if there's anything to prevent our stylists from working outdoors once the measures go in place. You guys know the answer to that question.
There's many models of stylists around the state of California who are moving their businesses outdoors, and there's lots of media coverage around that, so I think you can easily find that online. And there are guidelines that have just been released last week about outdoor operations for hair stylists and others to move their businesses outdoors. One specific note is that outdoors means that you can have an awning overhead, but it can't have any side walls. So it can't be a tent-like process.
We have a couple more minutes here. Nick, do you have another question? Want to go ahead and ask?
Yes, thanks, Jason. Following up along the lines of the business question about salons potentially doing business outdoors, I kind of have a more general question about what kind of outreach is being done either through Save Lives Santa Cruz County, through the Economic Recovery Council, or otherwise to inform businesses and prepare them for what now seems like an inevitability almost that some additional restrictions are coming. Can you just summarize what's being done? This question's for anyone who wants to take it. Thank you.
Well, this is Dr. Newell again, and I would say that I've continued to meet weekly with the Economic Recovery Council. I keep them up to date with every restriction that I hear as it's happening, so they are well aware of the coming restrictions. And they're each working with their own industries, and the Chambers of Commerce also meet with us. So they are aware and disseminating the information out into the business community. And they are holding a number of town halls as well to help spread the word. So look for those in the upcoming couple of weeks.
And another question from Jake Pierce at the Good Times. Jake, are you still there?
I am, yeah. I had a question about the most recent patient who died with COVID-19 being a contributing factor. Has contact tracing begun investigating whether the patient caught the coronavirus before or after being admitted? What do we know about that?
He tested positive on admission, so he was already positive before he came in. So it was definitely not hospital acquired. And there are other household members who have tested positive. So it is assumed to be a close contact, person-to-person contact prior to hospitalization.
Thanks so much.
We have one more in the room from Drew.
On the hospital topic, Dr. Newell, earlier you mentioned that reaching 20 hospitalizations was the trigger. What did that mean exactly, or what does that mean?
When we submitted our variance attestation, we made a list of triggers that we would use locally. This is separate from the database, and those you can find on our website with the indicators. And you can see there's, I think, 3 triggers we've now met from our own. The state doesn't hold us to any of those, but it's our own triggers that we would look at to show that we're moving into a surge.
Got it. How many of those 3 have we hit at this point?
No, there's many that have been listed, and we've hit 3.
We've hit 3.
Yeah, and you can find that on our website.
And I apologize, I have actually one more question from Kara. This is actually for Dr. Ghilarducci. Says the state dashboard at the end of June said we had only 4 available ICU beds in our county. How concerning was that for you, and is there any way to increase our capacity?
Yeah, thank you for that question. Yeah, I'm not specifically familiar with those statistics at the end of June, but I will note that that there were other hospitalizations, other reasons for people to be in the ICU. There were people that were, placed there for non-COVID reasons. We've also, at least in the case of Dominican, have accepted a couple of patients from out of county that are ICU level care patients with COVID. So they actually come from out of county. It's because Dominican has some special capability with ECMO that they've been asked to take these patients. So it is a concern. ICU, I think, is the Achilles heel in our hospitals. Dominican has done a lot of planning, as has Watsonville, in terms of surge planning for ICU, including taking over spaces that are not normally ICU spaces. We're not anywhere near capacity with respect to that surge at this point, but it's something that we continue to watch closely.
Great, thank you all very much for showing up today, and for the callers on the phone for calling in. We appreciate it. We'll probably do these semi-regularly going forward. Thank you.
Thanks for being here. It's nice
Thank
to
you.
have